Hey, what's going on, family? We back in the ER, but my wife wanted me to explain to you guys what's going on with her. So basically, she have what is called the Nutcracker Syndrome, and I'll try to be brief as possible. Uh, so basically, the Nutcracker Syndrome is a structural disorder, meaning that the way her anatomy is set up is causing problems on her other parts of her anatomy, meaning like, so you have this superior mesenteric artery, right? It's the abdominal artery that runs down, and what branches off of that artery in the abdomen, right, is your renal vein that goes into the kidneys. So what's happening is what's happening is the abdominal artery, right? That artery is actually squeezing down and compressing down. It's kind of sandwiching the renal vein, causing pain, blood in the urine, nausea, vomiting, and the pain is causing like severe high blood pressure that she never ever had, never experienced. Also, it's causing her chest pains, and it's affecting her kidney. Okay. In severe cases, chronic cases, people have lost their kidney, went into renal failure and all these different things. Thank the Most High that she doesn't have these things. We caught it pretty early. And also, and they caught this on imaging, right? They did a abdominal scan, and also with that scan, they found that she has aneurysm. When they did a angiogram, they found she has 2 aneurysms. And what an aneurysm are basically weak linings of the vessel walls where it kind of balloons out. Hers are very small, but when they get big, it's something to worry about. Hold on, guys. Hey, how you doing?
Hey there. I'm Diane. I'm going to be your nurse the rest of the day. I just wanted to check in.
And my apologies, guys. There was a nurse that came in to talk to us. So I think I was talking about aneurysm. So basically, an aneurysm is a weak portion of the artery wall. It kind of balloons out, just like like if you had like a tire or a basketball. You know, when you get that knot in there and it balloons out, that's a weak area. A blowout could happen soon, or, you know, so, I mean, basically, if you have a blowout in your arteries, then, you know, it's not good. You'll bleed out. But this syndrome, you know, back to the Nutcracker Syndrome, it's causing a lot of problems as it squeezes on, you know, the artery. The artery squeeze on that vein. It causes a lot of different things, a lot of, you know, problems for her. And, you know, so the main thing we want to watch is like her blood pressure and, you know, having blood clots and things like that as blood back up, you know, and then she, you know, has blood in her urine, you know, she bleeds every now and then. So it's pretty crazy, man. Tomorrow we have surgery. Tomorrow we have an appointment about surgery. So hopefully we can get that done. And then the thing about it too is this is the first time that this certain doctor would have done this type of surgery. He's done other, you know, vascular surgeries, you know, and dealing with arteries and veins and hearts and things like that. So he's very competent. It's just that this is his first time ever doing a nutcracker type of surgery. So, and there's people that specializes in them. You know, we looked in Maryland. Actually, one is like not far from her brother's house. So you know, so we may relocate. Who knows? We might be in Maryland, right? So I don't know. But with that being said, your prayers, any way y'all can help will be fine. And you know, we're gonna do it like that. You know, and we're going to keep trucking. We're going to keep going. And, you know, the scale has to tip. It has to be balanced. So as much as bad as piling right now, we know the flip side, the good will pile soon. And so, hey, we got to just do it. You know what I'm saying? It's just what it is. You know, there's a lot to be learned, a lot to be had. You know, I think the Most High is really looking out for her because she would have, if this pain wasn't bad, she would have never came to get checked. And we would have never found aneurysms. We would have never found the things that we found, you know, so. Get that done corrected, you know, in the right way, she can go back to normal. You know what I'm saying? So, you know, play around with it. Don't do anything. You could lose a kidney or die, right? So we're not trying to have that. So much love and peace. Appreciate y'all.